This is Dr. Daniel Paull, orthopedic doc with Easy Orthopedics, and today we're going to talk about how to get rid of cubital tunnel syndrome. If you like this video, we put out new content weekly, so please like and subscribe. So cubital tunnel syndrome is almost like when you hit your funny bone and you get tingling in your pinky and half of your ring finger. That means you've hit your ulnar nerve. They say it's the bone, but there's really a nerve that sits in between, in a groove, right outside the bone. So that sometimes gets compressed and can cause the tingling going down your hand. And again, it's only in the pinky and half of the ring finger. Carpal tunnel is in these other fingers and this half of the ring finger, but cubital tunnel syndrome is just the pinky and this half of the ring finger. And so you may notice, everyone sometimes gets it when you've maybe been talking on the phone too long or your hand kind of goes numb. But some people kind of get it all the time, and that's called cubital tunnel syndrome. So what can you do about it? The first thing you can do about it, the first line of treatment, is something called night splinting. Meaning that groove that nerve sits in, there's a lot more space when the arm's like this than when it's like this. So what we do when we sleep is when we crank our arms inward, and that can actually compress that nerve. So the first step is to make sure you sleep with your arms straight. There's nighttime extension braces, but you can also use an elbow pad that you flip around, or you can even put a towel or wrap a towel around in there, just so you're not injuring the nerve at night. The other thing you can do are nerve gliding exercises. There are various exercises with kind of hand movement and elbow movement, and that sort of helps the tendons and everything sort of slide around, and that can also help with it as well. Steroid injections really are not used for cubital tunnel syndrome. They're sometimes used for carpal tunnel syndrome. But if all that fails, then the next step is to get a surgery on it where you actually go and release that nerve. Doesn't mean you cut the nerve. It means there's kind of a roof over the nerve, and you cut sort of the roof, and so there's more there's more space for the nerve, and it's not so compressed. So, but again, for most people, they don't really end up needing that. First thing I would do is night splinting and then nerve gliding exercises, and for a majority of people that's going to work. If not, then you're sort of looking at the nerve release, which does happen. It's not uncommon, but most people don't end up needing it. So I hope I was able to answer questions about how to get rid of cubital tunnel syndrome or how to treat it. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.